What, no fluoride.
Or mouthwash.
I don't like mouthwash, number one. Yeah, because that'll kill a lot of the good bugs too, and that's what we need.
Is that like what the fluoride's doing too, overkilling a microbiome?
So it is antimicrobial, which nobody talks about, but it does make your teeth more acid resistant. That is undeniable. It does make your teeth more acid resistant, but it's not lack of fluoride that's causing the cavities. Right. It's usually like, why is there so much acid in the mouth? What's happening? So like, I don't have a problem with fluoride topically. I'll use it here. I mean, I get samples of everything. I'll use it here and there. But I don't think personally we need to ingest it. I've never written a prescription for it in 8 years. But topically, I have no problem with people using it, especially like with your kids. As soon as they can kind of spit, do a little smear, brush, spit. That's fine. Do whatever you want to do. I will say personally, I buy like a hydroxyapatite toothpaste if I'm buying one for myself. But topically, I still think it has a place.
Because the hydroxyapatite, is that something that's naturally in our teeth?
Yeah.
Right.
Yeah.
And which is what? Doing a similar thing. Taking care of some of the acidity,
the
helping with the strength of our teeth.
Mm-hmm. Yeah, because acid basically is demineralizing the enamel. So it's kind of helping us keep it mineralized and strong.
We're just saying the fluoride is like an overkill.
I think ingesting it personally, I do think, because it isn't living just in your mouth.
Right.
Like it's going through your whole body, and there's stuff now like it's in your bones. Like what's it doing there? Because it's,
It's a halogen, and so it can also compete with something like iodine.
Yeah.
Right.
And like, so then you look at fertility rates are down, and a lot of women are deficient in iodine, and iodine increases fertility by like, I think over 50%. It's something wild. And so, right, it's all connected once again of like, okay, yes, obviously we're trying to prevent some type of deficiency in like the larger society, but like at what cost?
Right.
Like it's,
and the studies aren't that strong. It prevents like a quarter of a cavity. Like it's not like, I feel like I'd rather work on other things.
And it's like, when did it start? When did we start using fluoride, putting it in our water? It was all based around teeth, right?
Yeah, it was kind of by accident that they discovered it. And I think it's like 93% of the world that doesn't have fluoridated water.
I want to say, like, anthropologically, you look at some of these indigenous countries who don't have what we consider like great health in this country, and they have no teeth issues. So again, it's going back, what are we eating?
Like it's more of our processed diet, the lack of chewing, and like all these things.
The really firm foods that you have to chew 40 times, and how that's forming your jaw and forming your palate, and breastfeeding and what that does to your palate. And it's not the point is not adding fluoride to fix your cavity. Like that's not, you have a cavity, just use more fluoride toothpaste. Right. It's not that you're anti-cavity. It's like you got to look at all the other things.
Yeah. I feel like it doesn't solve as much as we think it does.
Yeah.
So, and I have concerns about the side effects. So I would say.
Well, especially if it's in our drinking water and ending up in our bones.
Yeah.
It's and it's like funny, like health, like everything gets politicized now. Like we were talking about fluoride in here the other morning in the gym, because there's a woman on Huberman that was good.
Stacy.
Yeah,
she's
Stacey.
really good. Yeah.
Good. Yeah, I was talking to somebody about that. And they're like, oh, you're an RFK guy. I'm like, well, no, but like, just because I see the science or feel one way about something doesn't mean that we'll like all the way in this camp.
That's
Correct.
nothing thinking once again.
Yeah.
And it's like,
I
we
like to
can't
operate
have
in the
these,
gray.
we can't